Now to an alarming update to share with you. On the soaring spread of a parasitic infection, the food and waterborne illness causes intense diarrhea. It's called cyclosporiasis.
Not the easiest thing to say, definitely not something you want to get. Michigan has reported more than 680 cases, up dramatically from just a week ago. And Illinois is seeing an increase too. NBC5's Kate Chappell is here with what health officials want you to know about this. Kate?
So both the Chicago and Illinois health departments say there have been more cases than usual this year, and they still haven't identified the source of the outbreak. Here's how Chicagoans are trying to avoid getting sick.
I would avoid cilantro.
Outside this grocery store in the city, Chicagoans are changing the way they're thinking about produce in the wake of an outbreak of the parasitic infection cyclosporiasis in the Midwest.
I know a few people who think they might have gotten it from one way or another, but aren't really sure, so I don't know what to avoid to miss out also.
I try not to eat while I'm out here, though. That's why I like to eat at home, because I get to clean it the proper way.
A source hasn't been identified yet, as cases in Michigan and Illinois climb. But produce like cilantro, basil, mixed greens, raspberries, snow peas, and green onions have all been linked to outbreaks in the past.
When you get sick with cyclosporiasis, the kind of symptoms that you would see include things like watery diarrhea. It can be really frequent, pretty severe. People talk about explosive diarrhea.
Other abdominal symptoms include loss of appetite, nausea, and vomiting. Illness can last anywhere from several days to more than a month, and symptoms can go away and come back again.
This is a manageable illness with very straightforward prevention steps. Wash your hands. Wash your produce.
It's not usually life-threatening, but dehydration can cause severe illness for younger and older patients, as well as those with weakened immune systems. And because of how uncomfortable the symptoms can be, the outbreak has some thinking twice about what they're eating.
I go out a lot, but now it's important to ask those questions when I do go to restaurants, and if they are aware.
So here are the general rules to reduce your risk. Cook when you can. Heating food to 158 degrees or higher kills cyclospora. Wash all fresh produce under clean running water, even if you plan to peel it. And wash your hands before preparing food. Be mindful of cross-contamination. If you do get sick, contact your doctor right away to get tested. Cyclosporiasis is treated with an antibiotic and drinking plenty of fluids and getting a lot of rest. Allison?
Definitely want to avoid it, though, at all costs. Thanks so much, Kate.